In this video, we will discuss about antifungal drugs. Here, we will discuss the definition, classification, mechanism of action, adverse drug reaction and uses of important classes of antifungal drugs. From the word itself, we can understand antifungal drugs are the drugs which are used for the treatment of fungal infection or mycosis. There are different types of fungus and which will causes different type of fungal infection. So these drugs are used to treat fungal infection. Now coming to the classification, antifungal drugs is mainly classified into antibiotic, antimetabolite, imidazole, azoles like imidazole and triazole, allylamine and topical agents. Antibiotics like polyene antibiotics like Amphotericin B, nystatin, hamicin. Then heterocyclic benzofurans like Griseofulvin. Antimetabolites like fluocytosine. Azoles like imidazole which are used topically like Clotrimazole, Ketoconazole, Miconazole and Oxyconazole, and systemic imidazoles like Ketoconazole, and triazoles like Fluconazole, Itraconazole, Variconazoles, then Posaconazoles, then allylamine antifungal agents like TERBINAFINE, and topical agent like TOLNAFTATE, and andesinic acid, benzoic acid, etc. So this is the classification of antifungal drugs. Out of this, Amphotericin, Griseofulvin, imidazole antifungal like Clotrimazole, Miconazole, Ketoconazole, Fluconazole are very important antifungal agents. So we will discuss the detailed pharmacology of these classes in further slides. Before jumping to the topic, let me remind you there are different azoles or different drugs which are end with azoles. So don't confuse other azoles with the antifungal agents like lansoprazole, omeprazole, cotrimoxazole, metronidazole. These are from other classes. These lansoprazole and omeprazoles are proton pump inhibitors. Metronidazoles are anti-amoebic agents. And cotrimoxazole are a fixed sulfonamide combination of trimethoprim and other sulfonamide drugs. So be clear with the imidazoles like cotrimoxazole, Iconazole, Miconazole, Oxyconazole, Ketoconazole, Fluconazole, Itraconazole and Variconazoles. Let's start with the first antifungal drug, that is Amphotericin B, which is an antibiotic which is used for the fungal infection, and it is obtained from the Streptomyces nodus. And coming to the mechanism of action, this Amphotericin B have higher affinity for the ergosterol. Ergosterol, the essential material which are present in the fungal cell membrane. So due to its higher affinity to ergosterol, they will combine with it and they will get inserted into the membrane. So by the several polyene molecule coming together to orient themselves in such a way to form a micropore. So by forming this micropore, it will increases the permeability of the cell membrane of the fungus, and it will lead to leakage of essential material and it will lead to the death of fungus. So that is the mechanism of action. Amphotericin B will bind with the ergosterol in the fungal cell membrane, and thereby it will form pores in the cell membrane and it will lead to the leak out of the content and finally the death of fungus. Now coming to the spectrum, Amphotericin B is a wide spectrum antifungal agent which can be used for the treatment of yeast and different fungus. And these are some examples of fungus which can be inhibited by Amphotericin B: Candida albicans, Histoplasma capsulatum, Cryptococcus neoformans, etc. Now coming to the adverse drug reaction, Amphotericin B reaction will produce acute reaction usually occur with each infusion, and it usually consists of chills, fever, aches and pain all over the body, nausea, vomiting, dyspnea, which will last for 2 to 5 hours, probably due to the release of cytokine, which is an anti-inflammatory agent which will lead to difficulty in breathing. And long-term use of amphotericin B may cause long-term toxicity like nephrotoxicity, acidemia, that is the increased nitrogen content in the urine, reduced glomerular filtration rate, acidosis, hypokalemia and inability to concentrate the urine. So these are the some important long-term toxicity of amphotericin B. In CNS, it will occur, CNS's adverse reaction will occur only on intrathecal injections. Headache, vomiting, nerve palsies are the important adverse drug reactions. Now coming to the drug interaction, amphotericin B is an important drug which will cause nephrotoxicity. So when amphotericin is combined with other nephrotoxic drugs like aminoglycoside, vancomycin and cyclosporin, there may be a chance for renal impairment. So it will potentiate or it will synergize the nephrotoxic action of amphotericin B with other nephrotoxic drugs. Now coming to the uses, amphotericin B is applied for oral, vaginal and cutaneous candidiasis and otomycosis as a topical agents, and it can be used for the febrile neutropenia, leishmaniasis and intestinal candida. So these are the different uses of amphotericin B. Now coming to next antifungal agent, which is also an antibiotic, Griseofulvin. It is an antibiotic which is extracted from another fungus, Penicillium griseofulvum. Now mechanism of action, usually this Griseofulvin will interfere with the mitosis and also by abnormal metaphase configuration. So how they will interfere the mitosis? As we know, there is a protein which is known as tubulin, which is essential for the separation of daughter nuclei during the mitosis process. So this Griseofulvin will bind with the tubulin protein and they will inhibit the mitotic spindle formation, and which will result in the inhibition of separation of daughter nucleus. So thereby it will produce a fungistatic effect. It will inhibit the growth of fungus. Now coming to the adverse drug reaction, the important adverse drug reactions are headache, GI tract disturbances, CNS symptoms and peripheral neuritis, rashes, photoallergy, which may one discontinuation when this occurs, rashes and photoallergy occur. Then there is a chance for gynecomastia and transient leukopenia and albuminuria without renal damages. Now coming to the drug interaction, Griseofulvin will induce some enzyme and it will hasten the metabolism of warfarin. So the effect of warfarin will be decreased along with the Griseofulvin concurrent administration. Then efficacy of oral contraceptive may be lost due to the induction of enzyme, and it will lead to metabolism of the oral contraceptive if it is taken along with the Griseofulvin. Phenobarbital will reduces the oral absorption and it will induces the metabolism of Griseofulvin, which may lead to failure of therapy of fungal treatment. And the Griseofulvin may cause intolerance to alcohol along with the alcohol consumption. Now it is mainly used for the treatment of Tinea captatis, then Tinea barbae, Tinea pedis and onychomycosis, which is a fungal infection which will occur on the nail by Tinea unguium. So that is the uses of Griseofulvin. Now coming to the next group of antifungal agent, very important group of antifungal agent, that is imidazole. Example like Clotrimazole, Iconazole, Miconazole and Oxyconazole, which are administered topically, and Ketoconazole is administered systemically. Now coming to the mechanism of action, the ergosterol, as we all know, the ergosterol is an important compound which is required for the synthesis of fungal cell wall. So this imidazole will inhibit an enzyme lanosterol 14 methylase, which is an essential material for the synthesis of ergosterol from lansterol. So by inhibiting this enzyme, it will inhibit the synthesis of ergosterol, thereby it will inhibit the fungal cell membrane. So that is the mechanism of imidazoles like clotrimazole, iconazole, miconazole, oxyconazole and ketoconazole. Now coming to the adverse drug reaction, clotrimazole will produce gynecomastia and menstrual irregularities, and the uses clotrimazole is used for the topical treatment of tinea infections like ringworm, and for oropharyngeal candidiasis, usually 10 mg of doses of clotrimazole is dissolved in mouth 3 to 4 times a day, or used as a lotion gel which is applied in the mouth, and it is also used for the skin infection caused by corynebacteria. So these are the uses of clotrimazole. Now another important imidazole antifungal agent is ketoconazole. It is a first orally effective broad spectrum antifungal drug. The oral absorption of ketoconazole is facilitated by gastric acidity because it is more soluble at lower pH. So it requires acidic pH for the absorption of ketoconazole. Now coming to the adverse drug reaction, it will produce nausea, vomiting, and this can be reduced by giving the drug along with the meals. And other adverse drug reactions are loss of appetite, headache, paresthesia, rashes and hair loss. And most important drawback of ketoconazole for antifungal therapy is hormonal effect. It will decrease the androgen production from the testis, and also it will displace the testosterone from the protein binding site. So these are the important adverse drug reactions of ketoconazole. Now coming to the uses of ketoconazole, it is mainly used for the effective treatment of dermatophytosis because it is concentrated in the stratum corneum and deep mycosis. Used as a lotion or shampoo for the treatment of seroria of the scalp and dandruff, and also for the treatment of dermal leishmaniasis and Kala-Hazard. High dose of ketoconazole has been used in Cushing syndrome to decrease the corticosteroid production. So these are the important uses of ketoconazole. Now coming to the drug interaction of ketoconazole, as I mentioned before, ketoconazole absorption will be increased only in acidic pH. So if there any drug which will reduces the gastric acidity, it may lead to the decreasing absorption, like H2 blocker, proton pump inhibitors and antacid will decreases the oral absorption of ketoconazole by reduced gastric acidity. And rifampicin and phenobarbital, carbamazepine and phenytoin will induces the metabolism of ketoconazole, and it will reduces the efficacy of ketoconazole if it is administered along with this kind of drugs. And ketoconazole will inhibit many enzymes, and especially cytochrome P3A4 and cytochrome P2C9, etc. So thereby it will increases the it will reduces the metabolism, and it will increases the blood level of different drugs like phenytoin, digoxin, carbamazepine, omeprazole, diazepam, cyclosporin, haloperidol, nifedipine and other dihydropyridine, warfarin, HIV protease inhibitors and sulfonylurea statins. So these are the important drug interactions of ketoconazole. Next antifungal agent which are used for the fungal infections are triazole antifungals like fluconazole, itraconazole, voriconazole and posaconazole. Fluconazole. Fluconazole is a water-soluble triazole which are having a wide range of activity than ketoconazole. And the main advantage of fluconazole with ketoconazole is fluconazole is 94% absorbed orally, and its bioavailability is not affected by food or by gastric pH. That is the advantage of fluconazole when compared with other imidazoles like ketoconazole or other imidazole antifungal agents. Now coming to the adverse drug reactions, It will produce nausea, vomiting, abdominal pain, rashes and headache. And it may lead to elevation of hepatic transaminase, which is observed in AIDS patients. And this is contraindicated in pregnant women as well as lactating mothers. So it is better to avoid in pregnant as well as lactating mother. Now coming to the drug interaction, it will increases the plasma level of phenytoin, astimizole, cisaprate, cyclosporin, warfarin, zidovudine, sulfonylurea, and it may cause some cases of ventricular tachycardia with fluconazole given with the cisaprate. So these are the important drug interaction of fluconazole. Now coming to the uses, it is used for the treatment of vaginal candidiasis, oropharyngeal candidiasis, most of the tinea infection, coccoidal meningitis, cryptococcal meningitis, cutaneous candidiasis, and fluconazole eye drop is useful in fungal keratitis, systemic and mucosal candidiasis in both normal as well as immunocompromised patient. This fluconazole can be used as an antifungal agent. Now coming to next group of antifungal agent, allyl amine antifungals like terbinafine. This is an orally and topically active drug against the dermatophytes and candida, belong to new allylamine class of antifungal drugs. Now coming to the mechanism of action, as we mentioned before, ergosterol is an essential material for the cell wall synthesis of the fungus. And this ergosterol is synthesized from the lanosterol, and lanosterol is synthesized from the saccharine. And this saccharine is converted to lanosterol by using an enzyme saccharine epoxidase. So these drugs, terbinafine or allylamine antifungal agents, will inhibit this saccharine epoxidase enzyme. Thereby it will inhibit the conversion of saccharine to lanosterol, from which the ergosterol is synthesized. So the total process can be inhibited. So it can used to treat the fungal infection by inhibiting the cell wall synthesis of the fungus. So that is the mechanism of action of terbinafine. Now coming to the adverse drug reaction, terbinafine may cause gastric upset, rashes, taste disturbances, hepatic dysfunction, hematological disorder and severe cutaneous reactions. So these are the important area. Now this terbinafine is used for the treatment of localized tinea pedis, tinea cruis and tinea corporis and tyrosis versicolor. And in these cases, terbinafine used as an 1% cream twice daily, and it can be also used for ongomycosis, tinea captitis and widespread lesions by using oral treatment with the 250 mg of 250 mg OD. So that is the uses of terbinafine as an antifungal agent. Now last group of antifungal agents are topical agents like TOLNAFTATE and QUINIODOCHLOR. So this TOLNAFTATE, it is an effective drug for the tinea crudis and tinea corporis, and most cases usually this TOLNAFTATE topical application respond after 1 to 3 weeks. Because of poor penetrability, it is less effective in tinea pedis and other hyperkeratinized lesions. Now another antifungal agent which is used topically is QUINIODOCHLOR. Usually this is administered by oral route, and it is used as an luminal amoebicide. It also have weak antifungal and antibacterial activity. By external application, it has been used for dermatophycosis, mycosis barbae, serobic dermatitis, infected emphysema, then furunculosis and pityriasis versicolor. So these are the different uses of QUINIODOCHLOR. So here we had discussed different classification, mechanism of action, ADR and uses of different antifungal agents. Hope it is clear. Thank you for watching this video.